When do this, I feel pain.
You feel pain?
Yes.
Okay. Discomfort or pain?
Yes, this part.
Posterior shoulder. In here.
Here, even until
In down.
down. Yes.
Okay. Any pain or just weak?
Pain.
Pain. Okay.
This side, yes.
Do your impingement test. When I do your Hawkins-Kennedy test, which is when I bring your arm into this position and turn in,
Yes.
it's compressing the tendon.
Okay. Oh.
All right, you ready to get popped?
No. Yes, yes.
Good.
It's the sound, the scare.
It's the sound
I'm
that's
very
scary.
good.
Yeah. Now externally rotate.
Like
Externally
this.
rotate, yes. Go back. How's that?
It's better.
Yes. Okay.
I have more range of motion and
Motion.
less pain.
Less pain. There we go. All right. What's up, everybody? Dr. Ranen here. Today I'm here with Gabriella. Gabriella is a personal coach and competitive bodybuilder based here in Dubai. She won Arnold Amateurs last year and will be competing again this year. She's got right-sided neck pain and shoulder pain. It initially started as neck pain and then has progressed to the shoulder. So because of the close relationship in nerve supply between the shoulder and neck, and then obviously biomechanical relationship between the shoulder and neck, we're going to start off by examining a neck and then move on to the shoulder, see what we can find, and as always, see what treatment we can provide for her. All right, let's get going. Okay, we start with testing your reflexes just to see everything's working as it should. Relax your arm for me. Okay, hand on your hip for me. Sometimes when patients have neck pain and shoulder pain, they don't know that the symptoms have gone down into their hands and fingers. Of course, the nerves from the neck travel all the way down the hand,
it
right?
cuts on me. I even had
In your fingers,
in
yeah.
the-
So it's always good for us to start with the basics and then move over to the more
Okay.
fun stuff, right? Can you feel that?
Mhm.
Same both sides?
Yes.
Here,
Same.
here,
Same.
here,
Yes.
here,
Yes.
here,
Same.
here, here.
Yes.
Okay. Grip for me. Okay, good. Turn your hands over. Lift your fingers up. Hold for me. Don't push down and don't pull back. Okay, just hold your fingers. Good. Make a fist for me. Lift your wrist up. Hold. Hold, hold, nice and strong. There we go. Better. Hold for me. Good. Turn your hands over. Lift your wrist up. Hold for me. Good. Hold for me. What we see there. Slight weakness. Make a fist for me. Okay, I'm going to push in. You're going to turn over. Okay, good. Same thing. Turn in. Good. All right, turn in for me. See that slight weakness there?
Yes.
Yeah. Go the other way. Again, see, you have to fire your bicep. Just relax. Okay, try again for me. Much better. Okay. Let's do your bicep here. Hold for me. Don't let me push down, okay? Good. Relax. Hold for me. Don't let me push down. Good. Relax. Hold for me. Don't let me push up. Hold, hold, hold. Good. Let's do this side. Hold for me. Don't let me push down. You gotta try really hard on this side, eh? Hold for me. Don't let me push down. Good. Hold for me. Don't let me push up. Good. Okay. Lift your arm for me. Bring your elbow in. Hold. Don't let me push down. Good. Relax. This side. Hold for me. Don't let me push down.
For example,
Any pain in the neck?
always the same
Right side.
Yes.
Okay.
When do this, I feel pain.
You feel pain?
Yes.
Okay, relax. Okay. Look up for me. Do you have any pain in your neck?
A little bit discomfort here, this part.
Okay. Look straight ahead for me. Turn to the left. Any pain in the neck?
Always the same
Right side?
Yes.
Okay. Turn to the right for me. Any pain in the
Yes.
right?
Yeah. Always the same side.
Alright. Look straight ahead. Bend your left ear to your left shoulder. Any pain?
Yes. Here.
Right side. Okay.
This one.
Bend your right ear to your right shoulder. Sensitive?
A little bit. I feel also pain.
Also on the opposite side.
Yes.
Okay. Alright. Let me move your head for me now. Leave your head loose. Close your eyes. Any pain there?
A little bit at the end.
Right side. Okay. Any pain here?
Yes. Here.
Okay.
Same. There is always the same point.
If I do this, any pain in the neck?
Yes, the same point on the right.
On the right side. Okay. If I push down,
Same.
same. Right
It's the
side.
same. Yeah, it's the
Okay.
same paper.
Leave your head loose. Any pain when I do that?
At the end here.
At the end. Okay. When I do that,
On this side a little
on
bit.
the opposite side. Okay. If I do that,
Yes. Ah.
more sensitive.
Yes.
That's called a Sperling's test. Okay. I will explain to you
Okay.
in a bit what that's for. When I push down, any pain?
Not really.
Not really. Okay. All right. So when you make a movement, you are using your muscle and joint. When I do the movement for you, I'm doing the job of the muscle. So if the pain gets better, it's coming from the muscle. When the pain doesn't change, it means that it's coming from the joint.
Okay.
All right? So that's why we spoke earlier in our case history. Gabriella was mentioning that she was doing quite a lot of soft tissue. This is why the soft tissue wasn't necessarily having an effect,
Okay.
because it's something more underlying.
Okay. It's
The
not
soft
only the
tissue-
muscle, it's also the
Yes.
joint.
The soft tissue was getting tight to more than likely protect the joint.
Okay.
Okay? Let's get both your arms forward for me and lift up as far as you can go. Up, up, up. Go, go, go. Any pain in the shoulder?
Not really.
Not really. Down for me. Any pain coming down?
No.
No. Okay. Let's go to the side. Up for me, please. You can relax the shoulder.
Okay.
Up for me as high as you can go. Any pain?
No.
No. And down for me. Let's do the opposite side. Up for me, please. Any pain?
No, but it's click, click,
It
click,
clicks.
click.
Okay. Bring your elbows in for me. You're just going to go out now as far as you can go. Any discomfort or pain?
Yes, this part.
Posterior shoulder. In here.
Here, even until
In down.
down. Yes.
Okay. Relax for me. Leave your arm loose. I'm going to do the movement now. Any pain in the shoulder?
At the end only.
At the end, okay. Any pain in the shoulder?
Clicking.
It just clicks.
Yes.
Okay. When I do this, does it start to pinch at the back?
Not really. Only now, maybe really at the
A
end,
bit,
but not
okay.
too much, too much.
All right. Let's do some orthopedic testing. The shoulder here. Leave your arm loose for me. Any pain in the shoulder?
Yes, I feel.
Yes. Okay. Yeah.
Yes.
Okay.
This side, huh?
We're gonna compare to this side.
Mm-hmm.
Leave your arm loose.
Yeah.
Any pain?
More
here?
pain
More
this
pain.
side,
There
yes.
we go. Yeah.
Yes.
Yes. Quite a bit. Okay.
Mm-mm.
Lift your hand for me. I want you to keep your arm in this position.
Mm-hmm.
Don't bicep curl,
Okay.
okay? I'm
Just
gonna
this.
push down, you're gonna push up.
Arm straight,
Yes.
right? Okay.
Go. Any pain in the shoulder?
In the shoulder, no, but somewhere else.
Over the forearm.
Yes.
Okay. Let's try this side. Any pain in the shoulder or just feels
No,
big?
no, here.
In
Yeah.
the forearm.
In the
Okay.
forearm, yes.
Make a fist for me. Point your thumb up. Up, thumb up. There we go. Turn down. hold for me.
I push
yes,
up.
yes. Any pain?
No, just tension here.
Tension
but
on
no.
the shoulder, okay? Come up. Okay, come down. All right, hold for me. Any pain or just weak?
Pain.
Pain, okay.
This side, yes.
Some pain, all right. Let's do some muscle testing, okay? Make a fist for me. You're gonna hold your arm here, don't let me push you down, okay? Hold, don't push out, just hold it strong, okay, against me. I'm gonna push. 1 second, let's go again. Out, out, there we go. Any pain?
Little bit in the same point.
Same point
Here, a little bit
at the
more back, yeah.
Okay. Hold here for me. Bring your elbow in. We'll try one more time here.
I push
Resist
up.
me. Pain.
Little bit, yes,
Okay.
here.
Over the shoulder. All right. Hold for me. Push back. Push. Not so
No.
strong, eh? 1 second. Up, up, up. Up, up. Hold for me. Pain or just weakness?
Weakness.
All right. We'll just do a comparison.
Yes.
Just for you and for the viewers to see, okay? This is a non-affected side. Hold for me, please. There we go. Lift up. Hold for me, please. As you can see, there's a big difference. Okay?
Yeah. This one is weaker, right?
Yes.
Because I have more pain than.
All right, make a fist for me. Resist me, okay?
Okay.
Any pain?
No.
Okay. Go in for me. Any pain?
No.
All right. With this hand, can you touch the shoulder blade here at the back? Great. And relax for me. This side. Not bad. Pretty much the same.
Yeah,
Okay.
but this when I do this, I have pain in the side. While when I do
Oh, here.
here in the shoulders.
In the shoulder.
When
Okay.
I do this one, when I do this, I don't feel
You
anything.
don't feel anything. Okay, let's get you on your back for me, please. On your back, please. You can lie on your back.
Lie down?
Yes, please. Okay, turn your wrist in for me. All right, you're gonna push towards your hip. Go. Good. That's your lat. Okay.
Yes.
Push across. That's your pec. Pretty good. Okay. Let's do the same on this side. Push towards your hip. All right. Turn your wrist in. All right. Push across. Okay.
Normally, this is my strongest
Strong
side.
side. Okay, you can sit for me, please. All right, you can swing your legs over. Let me grab a model. You can face that way.
Okay.
You can swing your legs over.
Yeah.
Okay, so I'm just going to explain to you what I think is going on, all right? So based on your symptoms, neck pain, stiff neck, difficulty in turning your head, some symptoms into the hand, we would often say that there is something irritating the nerve that's coming from the spine.
Sure.
Okay?
Yeah.
This is a normal disc. Here you have the nucleus, it's soft and jelly-like.
Sure.
And here you have the annulus, it's a little bit harder. Okay? This is a normal disc. Alright? The weakest part of the disc is the back. Alright? And then here you have your spinal cord and you'll have your nerve roots. Here and here will be sitting two nerve roots. Based on the sports that you are doing, which is weightlifting, which is what most of us are doing really, we are prone to having injuries of the disc that start manifesting as stiff neck, neck pain, trigger points, especially those trigger points down here in the scapula, on the shoulder blade, right? This is an injury to the disc, okay?
So it's on the nucleus.
Yes, okay, so the nucleus will push on the annulus and then you'll have a bulging onto the nerve root. Okay, so
it's like a sort of hernia, right?
Yes.
But the hernia push on the nerve.
correct. So when we, as I was explaining to you in the beginning, when we do passive range of motion, your pain still persists. Okay, so this means it's coming from the joint. The joint is essentially the disc and the facet joint, which is what we manipulate as chiropractors.
Okay.
I also mentioned to you to take note of the Sperling's test. When I rotate your head and I bend across, On the right side, it's quite painful. It is your most painful position
Yes.
that we put your neck into. A Sperling's test is a test for a disc injury. Okay? So I think that maybe you have something going on here. It could be one level, it could be multiple levels. It's nothing to be afraid of because it's not limiting you from doing any activity at the moment. But it's potentially why you are in the cycle, right? Where it's not really getting 100% better because what's been happening is you're focusing on the muscle component of it, right? Not actually the structural component of it.
Okay.
So how does this relate to your shoulder? When we start muscle testing you, your wrist extension and your pronation, okay, which is C5, C6, or supplied by the nerve at C5, C6 is weak, okay, and the shoulder, especially the deltoid, is C5, okay.
Okay.
So when you have nerve compression or nerve irritation, you have something called arthrogenic muscle inhibition. This is where the brain starts to shut down power going through the nerve, okay. When you have that shutting down of power, your arm's going to become inherently weaker. You can't see it, okay, but you're going to need to use more force to move a weight. That weakness causes weakening of the rotator cuff, which it is quite weak when we assessed you, all right? And so you have instability of the humeral head, the glenoid. So when you're doing your overhead movement, instead of being stable here, the humeral head will start to track up and compress the tendon in the rotator cuff. So when I do your impingement test, when I do your Hawkins-Kennedy test, which is when I bring your arm into this position and turn in,
Yes.
it's compressing the tendon.
Okay.
We often see this when the tendon becomes thicker, all right? So it could purely be coincidence that all of a sudden you're having a shoulder injury, but based on your history, I think the neck is what started to cause the shoulder.
Yeah, and
Okay?
it's in the morning. When I wake up in the morning, this
It's
part,
quite
then I
stiff.
start to move, and this is like clicking so much. But then after some movement, I'm okay.
You're much
But
better.
the moment that I wake up, I hear too much pain here and here on the shoulders.
Yes.
on
So
this part.
morning stiffness is also a sign of what we would call a degenerative disc, when the disc starts to lose its hydration. Okay. At night while you're sleeping, the disc is going to hydrate. If there's also a small injury, it's going to build up with inflammation.
Sure.
When you stand up and you get out of bed, you have gravity on the discs. That fluid needs to move. So when it moves, it irritates the nerves around it, and then it manifests as morning stiffness. Okay.
Understand.
A weak shoulder is also going to pull on your neck because the shoulder itself, it doesn't have any bony articulation to the spine. It's attached to the shoulder blade
shoulder
of the
blades.
scapula, and the scapula is attached to the spine through your rhomboid minor and major, as well as your trap,
Yeah.
right? Your trap superior, your trap mid, and your trap min. So there's no bony articulation. Any weakening of this is going to pull on your neck. So
So the consequently is the neck.
yes, you start to get stuck into the cycle. You overtrain your shoulders and your shoulder becomes heavy, it's going to pull on your neck,
Sure.
right? You have a bad night's sleep, or you sleep on a bad pillow and your neck becomes irritated, it's going to affect the shoulder,
Sure.
all right?
Makes sense.
So we're going to get going with some treatment, all right? So we've already spoke to Gabriella in the beginning. I explained to her what I do with my electro-stimulation. She's not a fan of needles, but we're going to see how we get along with treatment. I'm going to decrease the sensitivity of some of the nerves around your neck. The goal for me today will be to try and offload the shoulder, to give your shoulder some strength and stability so it stops irritating your
the
neck.
neck.
Okay?
Okay.
And then as time goes on, we'll work specifically on the neck to reduce the sensitivity. You have a dual problem, right? But when we need to pick which one is more serious, unless your shoulder is debilitating, we always go with the neck. Okay? Because this is where what's causing or what's responsible for your motor function. Okay? All right, guys. If you like what you've seen thus far, please make sure to hit the like button. Make sure to subscribe. Let's get going. All right? Let's get you to lie on your side for me, please. You're going to lie on your left side.
Yes. Your neck here.
Yes, please. Let's get you to lift your neck for me. I'll give you some extra support. There we go. Okay. this on. Great. So how long have you been in Dubai for?
6 years.
6 years.
Yeah,
And you are Italian, correct?
exactly.
Which part of Italy are you from?
Sicily.
Sicily, okay. So who inspired you to get into bodybuilding?
Well, actually, I was already a trainer since a
Yeah.
long time. I started as a fitness instructor, so group classes,
Yeah.
body pump, Zumba, all this kind of classes. And then I used to live in France before to
Yeah.
come to Dubai. So there I become personal trainer, and then I was here in Dubai, and I mean, in my free time, I say, okay, I want to really get it stronger and build my body. So I start bodybuilding. And then every time I was in the gym, a lot of people say, are you competing? Are you competing? And I say, no, what is competition? And say, no, because you have a very good
Physique.
body and physique, your small waist. And I say, no, I don't know what it is. And I was curious, and I started to saw and watch on Instagram some bikini competitor. And actually, I was in love of their physique. I mean, I didn't care about the competition or win or something, yeah.
There you go.
But I loved the result of the body, so I said, okay, let me try. And at the time, I had a coach here in Dubai that he also was a IFBB pro. So okay, we started for fun, and we started a mini off season. So
Yeah.
I gained a little bit more muscle, and then we call cutting the phase of prep. And then I went to Ohio 2 years ago, and I get 4th place as a first time. And then I took another coach in the 2nd year, and last year I get 1st place in the same competition Arnold. Then I went Thailand, and I went Olympia Amateur in Romania, and I get 4th place as well. So this year,
Nice.
inshallah, let's see.
Yeah. All right, we're going to start. I'm going to target the trap first. So you obviously have this knot here, right?
Yes.
Okay. So you describe it as a knot, but just in the front of the trap is a nerve. It's called a supraclavicular nerve.
Yeah.
And when you have a sensitization of the nerve at its root here in the neck, this nerve is going to become very sensitive. This is going to cause the trap muscle to become tight to protect the nerve. So instead of loosening up this trap, which we were having a chat during our case history, and Gabriella mentioned that when she did soft tissue, it would aggravate her pain. This is very common when the pain is coming from a neural issue rather than a muscular issue, because the muscles are tight to protect the nerve. By working on them and compressing them, you further increase the sensitivity of the nerve. So we're going to start here. You may feel a twitch response, okay? It can produce post-needle soreness, all right? It may last for a couple of hours before it subsides, okay? She doesn't sound too keen.
I'm scared.
All right. When I asked you what motivated you, I thought you were going to say Franco Colombo,
Why Franco Colombo?
the Sardinian giant, right?
Of course.
Yeah.
I mean, I do bikini, but I'm very fond of bodybuilding in general.
Yeah.
So I also follow all the men bodybuilding, classic physique, men physique. I love all the category.
Okay, we're going to start slowly. How's that?
I'm okay. So far, so good.
Not too bad?
No, honestly, no. If this
You feel
is
the
what
muscle twitching?
I feel, this kind of popping.
Yeah.
Yeah, I feel it. If it's like this, it's okay.
You're fine. Okay, we'll keep it really light.
So in this moment, you are like moving the nerve.
No, the nerve will move inherently because we're stimulating that area, but what I'm using is a TENS current, okay, and I'm using anatomical landmarks or bony landmarks to identify where certain nerves are most superficial to the skin.
Okay.
Then I'm using the needle to go into their vicinity and using the electro-stimulation to kind of change the frequency that the nerve is functioning at that moment. You good?
I'm good.
All right. Great. Alright, we'll move to the next muscle now, which will be your pec. You may feel a twitch here. Good, no twitch. Alright. We'll start off slow again.
Yeah, I feel it. This one I feel more.
So far, so good.
Yeah, but this one I felt more than the first one.
Alright, we're going to work on your lat. Let's get this arm up. Place your hand here. Okay. Now, the lat is not as sensitive, but it produces a strong contraction, okay? You got a bit of a twitch response there.
Oh.
You okay?
Mm-hmm.
You feel the lat contracting exactly?
Yes.
Yeah. Oops. Okay. We almost.
That was the worst.
That was the worst one. All right.
It's okay. It's good. Don't worry. You can come. It's me that I'm very, very sensitive.
All right. Now we're going to do what's called the dorsal scapular nerve. Okay. It sits right under this little trigger point here called the levator scapulae muscle. Now with this one, you're going to feel your rhomboids, okay? Feel it?
Yes.
Alright. Next one is your axillary nerve. Now you feel this tight spot here. Okay. So when you externally rotate your arm, you feel the tension at the back of your shoulder. Okay. Feel that twitch? Yeah. This is where the axillary nerve is passing. The axillary nerve is the nerve that gives pain to the anterior lateral part of the shoulder. So again, when the neck becomes sensitive or sensitized, or you have some type of nerve irritation, all these nerves start to get switched on or switched off. I know the right spots, eh?
Whoa. Yes.
All right. We have 2 more to do, and then we're going to retest you, okay?
Okay.
All right. So normally I would do trapment. I would do a long duration stimulation for the rotator cuff, but because it's Gabriella's first time, she's a bit sensitive. We're going to try and do as much as we can, but not overload her. Sometimes I have found in my experience that when you overload the patient at the first session, they tend to not respond as well as we want, and we want to see some positive changes. Whether that be to her mechanical function or pain, it doesn't matter. We just don't want her to go backwards. So this is your supraspinatus. Okay.
I feel everything.
That's good. It means you're alive.
Well, thanks God.
A small bit of blood here. Get that right off. Okay. Now we do your infraspinatus. Okay.
Ah.
Yep. Again, you may feel a twitch here.
So basically this twitching is like release the tension?
No. The twitching is the electro-stimulation stimulating the muscle, right? Depending on what type of nerve we're targeting, it may release the muscle, it may also engage the muscle. Okay?
So it's this contraction.
Yes.
And what's this the effect of
The effect is on the nervous system.
Okay.
It's not contracting the muscle.
Do I have to know?
The contraction of the muscle is a consequence of us passing the electrostimulation through it. Okay? Depending on what the issue is with the nerve in that area, the nervous system will then decide, okay, do I need to release the tension in this muscle?
Okay.
Do I need to give this muscle more power?
Okay.
Okay?
So actually you did this because it's gonna like connect with the nerves.
Correct.
Okay, good.
Okay? Instead of pushing on, everyone has a different technique that they use. This is my technique, okay?
Yeah.
I do soft tissue. I do your traditional dry needling. I don't do cupping, but I use this technique. All of these things, cupping, soft tissue, dry needling, intramuscular electrostimulation, they all have the same sort of effect. Some have more effectiveness than others, okay? This is what I have found to be most effective for my patients, for the goal that
much
I want
more
to
than deep tissue.
Yes.
Because this I did so many and it was worse and worse and worse because they were pushing on the knot and instead I feel that this one is really in the trigger point, exactly in the
muscle.
point.
Yeah.
Okay.
All right. Let's check out your shoulder range of motion again. Let's get your hands forward for me and up as high as you can go. Okay. Any sensitivity in the shoulder?
No, I feel just where you put the needle, just a little bit, but no, honestly, not so
Down
much.
for me, to the side, and up for me, as far as you can go. How's that?
It's better.
Yeah.
I feel just a little bit at the end, a little bit clicking here, but I have more range of motion.
Yeah. In for me, now externally rotate. Externally rotate, yes. Go back. How's that?
It's better.
Yes. Okay.
I have more range of motion and less pain.
Less pain. There we go. All right. Let's test some of your muscles. Okay. Bring your wrist in for me. Hold. Push up. That's much better. You feel how much stronger that is. You're able to lock out. All right. Push back for me now. Back. Palm forward. Palm forward. Here we go. Push back now. Push. Push. Look at that.
Yeah. It's true.
Yes. Hold, push back for me. Push, push, push. Look at that. Much better. Bend. Make a fist for me. Push back for me. Great. Okay. Down, in. Push in. Great. Let's check the supraspinatus. Hold for me. Here. Okay, push out. Any pain?
No.
Great. On your back for me, please. Yes, please.
The pain is the needle, but isn't it better?
Yeah. All right. Okay. Push towards your hip for me now. Push, push. Look at the difference.
I'm stronger. It's true. It's true.
Push across for me. Push, push, push. Okay.
That's
So-
the pack, right?
This is PEC,
PEC.
yes. So, we haven't fixed your problem, but we've improved your biomechanical function. Okay? The system that I use in my approach in treating patients is to improve biomechanical function first before treating the area of injury. What I have found in my experience is if we go to treat the injury first without improving form and function, the patient feels better, but then the
It's
injury
gonna
comes
come back.
Okay?
Makes sense.
So, for viewers out there, and just so that you are aware, this would not be the cure to your issue. You know, it would be a step-by-step process where we ultimately start to work our way up to the neck.
Sure.
Use spinal decompression to stabilize the disc. Use intramuscular electro-stimulation to fire up the muscles that are stabilizing the disc and decrease any sensitivity from the nerve root. And then we start with exercise therapy, stabilizing the neck first using isometrics, improving your thoracic mobility, and then obviously working on shoulder stability, scapular mobility and stability, shoulder mobility and stability.
Okay.
All right?
Good.
So, you've never been to a chiropractor before, correct?
Yeah, not. I did some.
You have. You've done some manipulation, okay?
Yes, I did.
Are you also scared of that?
Yes.
Okay, so...
The only things I'm not scared is lift weight. The other things, everything scares me.
Alright, so we're going to do some manipulation for Gabriella now, and that'll be it for us. Let's get you to sit for me, please. I'm going to scoot forward a bit for me.
There?
Just move forward, yeah. Okay, let's get you to lie back now. Okay, you can move up again for me a little bit. Move up.
Up?
Yes, please. Okay. If you guys have any questions on neck pain and shoulder pain, please drop them in the comment section below and I'll be more than happy to answer them. All right, you ready to get popped?
No. Yes, yes.
I think Gabriella thought she was coming here for a haircut today.
No, I thought massage.
Let's get
All
you
the
to
massage.
hug yourself. All right. Let's get you to lift your head for me, please. Lift. Okay, I got you. Leave your body loose. Okay. Inhale and exhale. Inhale and exhale. All right, last one. Drop your head back. Turn your head to the right for me, please. Inhale and exhale. You alive?
I'm alive.
All right, let's get you to sit for me. I'll pop this.
No,
Pop this out.
After it's better, but the moment is scared, but it's good. I swear.
Let's get you on your
Some
back.
the people that are scared, don't be scared like me.
Let's get you on your back for me, please. The people that are following us are addicted to these videos. They know all about the cracks and the pops.
Okay,
Right?
perfect. So
Yeah?
maybe I'm the only one scared, but
No.
then I know
No.
the post is nice, but the moment it's like scary.
Yeah, I had a patient that came in 2 weeks ago, and she wanted the manipulation, but when I set her up to do it, she was too scared. She asked for like some time to pray, and then she asked for some time to pray. I gave her like 15 minutes. She couldn't bring herself to do it, and I haven't seen her again. So, you know,
I mean, everyone will react to
differently. Yeah.
Exactly.
Let's get you to bend your knees for me, please. Both sides. Okay. Which is more sensitive, here or here?
What do you mean? Which side?
Yes, which side?
right side.
Right side. Okay. Leave your head loose for me. Inhale and exhale all the way out. Good.
It's the sound, the scare.
It's the sound
I'm
that's
very
scary?
good.
Yeah?
But the sound, oh my god.
Okay. Let's get you to sit for me, please. Sit. And then you're going to lie face down. Yep, there we go. You're going to place this hand under your hip for me. Just this hand. This hand you're going to place down here. Alright? You're gonna turn your head to the right. To the right for me. Is that your right? Yes, to your right. Turn your head left and turn. There we go. Rest your arm here. Inhale for me and exhale all the way out. Okay. All right. Let's get you to sit for me. See what's going on here. All right. Leave your head loose. How does that feel?
It's better, but I still have pain here.
At the base of the neck.
Same line,
Okay.
same side.
Sensitive
This
there?
is worse.
That's the worst. Yeah. Okay. And sensitive there.
Yeah, same
Okay.
spot.
Same spot.
Yeah.
All right. Okay, guys, that brings an end to our session today. What we did was we tried to stabilize the shoulder as much as we could. We were able to improve biomechanical function. We were able to improve the strength, reduce some of the discomfort in range of motion. The next step would be to start working on the neck, working on the disc, stabilizing the disc, and neutralizing any issues that are going on in the neck. So Gabriella, would you like to let our viewers know where they could find you in the event they want to do some personal coaching with you? Where can they find you on social media?
Okay. First of all, thank you so much. It was really, really amazing. And then you can find me. My Instagram is Gabriella_trainer_Dubai. And I train normally in Train SF. I'm a freelancer, so they can just message me for some PT. And thank you really so much.
No
it was
problem.
so good. And see you soon.
Yeah, so we will probably look at doing a part 2 where we work on Gabriella's neck. Please look out for that, guys. Make sure to hit the subscribe button. Please hit the like button if you enjoyed what you've seen in this video, and hit the notification button for the next video. Take care, guys. We'll see you soon.